I don't really, I'm not my area of expertise of PAs and nurse practitioners. My assumption would be that those type of learners might be, it might be easier to move them around for the clinical experience. The physician residents, it's pretty prescriptive. It needs to be approved by a number of different layers. It's a little bit more difficult to change rotations around. However, they do have elective rotations, and if we can put a good argument forward, in especially around family practice, where one of the strengths of the university's family practice programs is that it really is geared towards a rural type environment, and the retention of those individuals in that type of environment is actually rather good. So we're going to do whatever we can to try to get it to that point. Again, I'm not going to sit here and promise you that you're going to get 30 learners or providers in here in the next 2 to 3 weeks. It's just not going to happen.
No, I understand.
Yeah. So we'll work very diligently. I can't, I unfortunately don't have a specific answer to your question.
Yeah. So when you say capacity, you mean facilities capacity, not
Client capacity.
But if you could, what about transportation? Do you have, I don't know how that would work from a liability standpoint or whatever, because you could use these town centers, if you will, like this community center we're in right now, something out in Tomé, to have people come at, say, every day 9, and they're transported within 10 or 15 miles. They see somebody, and then they're brought back here by noon or something.
Yeah.
Because I don't think you have transportation
No.
covered, but maybe you all could help with something like that. I don't know.
I don't.
You don't know.
I really don't. So I will look into that.
Yeah.
And from the transportation point, just so I'm very clear, because I think I've heard you correctly, you're talking about transporting patients into
Right.
provider centers, not transporting providers.
Right.
Okay. I mean, the other thing that we've been talking about, and again, this is not a panacea and will take some time to develop, is also using some technology.
Mhm.
So some
Okay.
telemedicine,
Yeah.
which, we, at UNM, we've, I think, have developed some capability around neurosurgery, around psychiatry.
Telemedicine stuff.
Yeah, I think that can go to a certain length for follow-up, but, primary visits when you don't know your provider, or people that need hands-on examinations, that's not going to solve that problem. It could certainly be a backup for providers of a little bit lower level to get more expertise consultation. It can probably be used pretty successfully for follow-up. So that's another thing that probably would merit some exploration. That would probably require some investment in the technology.
But
Not
you could also
huge.
invest in it here in a community center. People would come here to see someone in,
Yeah, I know we have the
Albuquerque
technology
or-
on our end.
Brazil.
The technology on the provider end, I think, is something that we can talk about. It's not, I don't think it's crazy complicated,
Yeah.
but it just needs to be done correctly.
We've had a long-standing relationship with Sanjeev Arora and the ECHO project.
Right.
And so at all of our sites, we provide a level of subspecialty care through our primary care providers. We do rheumatology, endocrinology, Suboxone for opiate addiction, hepatitis C, pain management, diabetes care management, all through telemedicine.
Right.
So we're connected to the network at our sites, which would be important.
And then certainly the other thing, I think that from the university standpoint, again, going back to the beginning of the conversation, where we do have our strengths, being able to better coordinate access into existing university resources, which are in Albuquerque, obviously, but for specialty, subspecialty care is something I think also that we need to take a look at. Because at the end of the day, if somebody got newly diagnosed rheumatoid arthritis, you need to see a rheumatologist, you don't want to wait 6 months. You want to try to be in there and get your treatment course on track.
Sure.
Is something else that we should probably be
Chronic pain.
speaking about. Yes. Yeah.
You were going to say something?
No, I just remember we sat here at this very location on the transportation issue, and the people from Los Lunas that run that service where people call and it costs them $1 for a ride. I just, out of curiosity, just did the little map thing, and it is 20 minutes from here to the Los Lunas facility, and it is 23 minutes from here to the UNM campus. Remember, I thought maybe UNM campus could do something. But I'm thinking from here and that bus service, here we go again, people just need to be educated on using that bus service. And they wouldn't even, because you can't tell them, well, all these people are gonna come in every day at
Right, yeah.
9:15.
And get picked up,
You
yeah.
gotta see them all.
Yeah.
But they drive around and pick people up.
But one person at a time versus the
No,
efficiency of showing.
Actually,
up.
the way they explained it to us, sometimes you have a long ride on the bus.
Oh,
It was, the little van.
but you're gonna get seen, yeah.
But, because they will kind of organize it, and you call a day in advance for your ride. And
So
they
you put a little map
drive it.
together
So
to be efficient.
I've known people that used it to get out to the college,
Mhm.
and they just plan that's when they do their studying or whatever, as the little bus thing picks people up. And it costs $1 for one way.
For basic services, do you have any mobile options right now where a mobile service vehicle goes out to, off the Gallup campus out there or something? I'm just thinking, I used to live in Zuni when I was a kid, and I remember they would bring a doctor out once in a while. And boy, you were lucky if you got to see it, But is there anything like that these communities could be put in that rotation somehow?
Right.
To maybe be another short-term option for basic care, very, very basic care.
So I wish I had an answer to that. I've only been at UNM since July. I know that I came from St. Vincent Santa Fe there. PMS had
For mobile options.
mobile options, mostly focused on schools.
Yeah.
I know that other organizations around the state have that mobile option.
Might be something else.
So that would be something to take a look at. Typically, those tend to be, obviously, they can kind of run a little bit of a gamut from really preventative type basic care all the way to pretty extensive care. So I know in Santa Fe, La Familia has a mobile option for homeless folks up there and focus very much on chronic disease. A lot of HIV, AIDS patients are hooked into that. So certainly, yeah, that's an option. Again, thinking through it, if you have the provider, you want to put the provider on a bus and bring them out, you want to put the provider in one place that people come to them. That's, again, I don't know. It's an operational question of how you use that resource most efficiently and what you really want to do. Because if you're talking about just, pinpricks and checking blood sugars,
Flu shots and.
flu shots,
yeah.
you don't need a doctor, you don't need a mid-level provider, you don't need a nurse. And if that, you probably just need, you may even just be able to get away with an MA or an LPN. So I think that's what really needs to be scoped is, my assumption is the needs are across the gamut.
Well, I think that the short-term goal is for an agreement between you and the university and First Choice to bring providers, if it's possible, to Los Lunas and Belen, and for us to somehow get the individuals from these two communities to buy into the option of being transported to take care. I mean, that's a short-term goal. My long-term goal is eventually to build a clinic here. But what I'm hearing you say, and I'm hearing you say as well, the provider shortage that we have in the country is the problem in terms of getting health care to the general population, basically. But for the short term, I think this is what we need to do, and we need to start it as soon as possible. And I know what you said, that you can't get them in, and it's not going to happen in the next 2 or 3 days. But I think the sooner we begin, the better we can get help for the people that really need help. And these two communities especially, I've just got to tell you, there's a lot of needs. And so I would hope that the two of you would work together to try to formulate a contract, if that's what it is, or some type of an agreement. If you need the county's assistance or the state's assistance, then we will include them, of course. Obviously, they should be part of this, the village, because you are located in Los Lunas and Belen, so getting everybody involved. And then educating the people here in these two communities to understand what it is. But one of the problems you're going to have, I will tell you, is in terms of undocumented individuals from the two communities that might be very leery of being transported into a different area. It's just the nature of the problem that is there. I mean, so and you'll find that there are a lot of undocumented individuals in these two communities. But we want to provide health care for everybody, regardless of they're documented or not documented.
I think that's everybody's goal.
And so I'm hoping the two of you can work something out. Let us know what you need on our end, and we'll be happy to start it as quickly as possible and get the individuals together that need to get together. If it's the county, the village, the municipality of Belen, we will put a group together to figure out how to get this done. But it just needs to be done. And this area, especially this area, and El Cerro Mission, has been ignored much too long. And nobody seems to want to take care of this area or the people up here. And it's time that they're recognized and they're taken care of a lot better than they have been in the past. It's just really difficult to drive through here and see some of the things we've seen, and to visit with some of the people that can't get health care or are afraid to get health care because of their situation. And we need to change their mindset to get them healthy, and to get the children healthy especially. That's our main goal. So thank you. If you have any more ideas, be happy to talk about it, but we've taken up a lot of your time already. And well, at least you had a good drive-through.
It's not a part of New Mexico.
Yeah.
Yeah,
I don't- I don't follow
I
it
would
at all.
one thing that's important to mention is that if we can, and we've been working together, as we put together an approach, that we're really talking about fairly comprehensive care. We're talking about medical, primary medical, we're talking about dental, which is a real issue
Yeah.
in this community.
Yes, it is.
And we're talking about behavioral health, which is a tremendous issue in this county. When you look at the state statistics in terms of behavioral health issues, especially drug abuse issues.
And if I'm not wrong, we do not have any behavioral health services available in our county anymore.
Yeah, I don't think
Anymore.
other than First Choice. We have
Yours.
Yeah, we have behaviorists at both of our sites, but we're gonna need, and we've been working with the university and other sites in getting psychiatric support for our behavioral health teams. And we've been very successful working with the Department of Psychiatry.
Yeah,
in doing that.
and that's very important.
Yes.
The university, we very much understand that.
Yeah.
And just, I absolutely agree with you. And Bob doesn't know this, so I'm just gonna, in this form, we're already starting to take a look at what legal structures we can develop for a closer relationship. So I've already had conversations with experts in the area. So this is something that we are working on. It will, again, because of the laws around healthcare, because of complexity of the healthcare industry, it is, you need to be very, very careful because you can run afoul of some pretty serious legislation. So it is something that needs to be done carefully, thoughtfully, both with the legal aspect and also, again, utilizing a resource that is scarce and much scarcer in this county, clearly,
Yeah.
than in other
I agree. You know, the other thing, Senator, that I mentioned earlier that I think would be very helpful, you know, as we develop this and we start serving more and more of the uninsured, and when I say uninsured, I'm not talking about just the undocumented. I'm talking about people who didn't qualify for Medicaid, went on the exchange, and now have deductibles of $5,000 or $6,000 in their plans. You know, when they come to us and are seen and present an insurance card, we certainly accept that insurance card, provide the services, and then when we submit that for reimbursement, we receive an EOB back, explanation of benefits back, saying, bill the patient, they haven't met their deductible of $5,000, $6,000. Well, that's really restricting people's access to primary care. They're not gonna go if they were gonna be held responsible. So we put them on our sliding fee scale again, you know, in order to provide that care, and so they'll come in for that primary care. So I mention that because it's an issue. Not everyone's insured, and there's a fallacy that exists that under the Affordable Care Act, everyone is covered now, and the reimbursement is flowing in supporting the cost of these practices. It's not.
So we have to educate those people as well to make them understand that there's a sliding scale.
That's
so
right.
that they can.
But we also need to work with our county indigent fund to help subsidize the cost. You know, if a person comes in for a primary care visit, and they have no coverage, or they have coverage on the exchange, but they have high deductibles, so we end up putting them on our sliding fee scale. And the average visit, let's say, including lab and everything for primary care is about $160, okay? And we slide them down to $30. We have $130 we have to find to make that visit whole, right? So the indigent fund in Valencia County needs to be responsive to that and help support the cost of care.
Have you ever talked to the county about it?
We've talked to the county for years, Senator, and a number of years ago, they made a commitment to start supporting the cost of some of the dental care for First Choice and some of the primary medical care at Presbyterian. To my knowledge, that's been very limited, if it exists at all.
Well, that's then bringing the county in.
That's
to-
right.
To come up with this, sure.
Yeah,
Then we'll have to do that.
yeah, because we're gonna have to support collectively the costs of moving forward and increasing manpower in this area. And as mentioned, you know, we're a business. We're a compassionate business, we believe, but we're a business. We need to be able to pay people to provide the care that we're delivering.
Yeah, and as we all know, that's really the difficult issue, is paying now for care that pays off in the future and avoids significant costs in the future if you can get it earlier. And that's really something that as a country we've been able to find a solution to yet. We're still in the business of, unfortunately, really investing mostly in sick care rather than in healthcare. And
Preventative,
yes, yeah, and on all levels.
yes.
Well, it's all those kids in the wall behind you. I mean,
That's right.
you know, if they don't learn at that age, then if you can get to them at this age, then it's a lifelong way of living
Yeah.
and, you know, how they lead their lives and stuff.
Exactly.
One thing I will mention, and I know, Bob, you have a lot of knowledge on this, and Senator, I don't know if Dr. Mello, if you know, but was a big fight to have an actual hospital here in Valencia County for a long time. I guess I'll use the word fight, it just seemed like it was really a struggle. But we gotta start with something. So in terms of our idea in this conversation of what a long-term solution is, it probably is a clinic. It's not this, it doesn't, a lot of people are out here, oh no, we need our hospital and everything, but yes, but you've gotta start somewhere. And so when you find that location that's ideal for where this clinic should be, that can be the start of kind of how you get to a hospital at some point, but they don't even have a clinic, you know, for these folks up here. So.
And I would say that is a very good insight in that you really do have to build the basis, because even if you have a hospital, where are you gonna get your cavity filled? Not at the hospital, right?
Yeah.
And most problems really are, or should be, at that level. With what I've seen of the statistics, I'm not, you know, I think you can argue hospital one way or the other, but big proposition, a lot of money, a lot of resources is that the best way to spend the money with where you are currently? I would argue, you know, I would probably spend all that money building up the primary care, bringing up the dental care, building up the access for a larger population. If that leads to a hospital,
Because
great.
if you wait to do anything until you can afford
Right.
a hospital, it may be another 30 years before you, or 20 years before you can actually get to that point. So, gotta start somewhere.
Right, and you know, again, hospitals are, well, bigger propositions where I spent most of my professional life. It's a much different animal than an outpatient clinic. What this community needs absolutely correctly access to healthcare, medical, dental, behavioral health. You can spread it out, dietary, social, et cetera, et cetera, et cetera. That's, if it were my money and I was making that decision, that's where I'd spend the money. I would not spend it on a hospital today. Not saying that you couldn't justify it, especially with new models of hospitals that are coming out. But today, I think that would make more sense.
Give me the statistics again in terms of nationally in here, in Valencia County.
Well, Franz might have more updated, mine are 2015, but it showed one provider per approximately 4,000 residents.
And nationally, it's,
That's for Valencia County. Nationally, it's one per about 1,000.
Yeah.
Okay. In New Mexico, across the state, it's about one per 1,500.
So the shortage of, this is in the healthcare workforce, was 36 primary care providers, 24 nurse practitioners, 15 physician assistants, 7 dentists.
Is that just for this county?
For this county, if you compare it to national numbers. And
Great
it's for a
skill to
county
get
of
into. If you can afford to
75,000.
get into it,
wow,
it's so expensive to
It's
get
massive.
into it.
wow, yeah.
It really is.
And how many doctors are we we graduating or practice, and how many PAs and nurse practitioners are we? Not very many.
Right.